Well, welcome everybody to Lunch with Dodie today. I'm really excited for our special guest today, Cassandra Hutchinson from ADRC, which is Aging and Disability Resource Connection. And she's going to talk to us today about the comparisons and the similarities, the differences, and all the services they have to offer everybody. So it's really great to have you here, Cassandra.
Thanks for having me. Northwest Senior and Disability Services is the parent organization. Most people know Northwest Senior and Disability Services because we are the ones who determine Medicaid eligibility for multiple counties. So we actually, as a whole agency, serve Marion, Polk, Yamhill, Tillamook, and Clatsop counties. So most of the valley and then the whole North Coast. We connect with Oregon Department of Human Services. We contract with them to offer programs like Medicaid, Medicaid long-term caregiving, food stamp benefits or SNAP, supplemental nutrition. We also have programs that help with Medicare costs, Oregon Project Independence, which is another in-home care program. And then we also administer programs under the Older Americans Act legislation, which includes things like home delivered meals that are operated out of the senior center, or family caregiver support, or options counseling, money management, and a whole slew of other programs. Northwest is also responsible for adult protective services, and so any type of investigation or concerns for our seniors or folks with physical disabilities happens through that department at the agency as well. And then as part of Northwest, the Aging and Disability Resource Connection is actually a department within Northwest Senior and Disability Services. And so we often answer the phone as Northwest Aging and Disability Resource Connection because we are, again, all part of the same agency. I am currently standing in our Salem building right now. And our Aging and Disability Resource Connection is just that. We are the entry point for resources and programs within our agency. What makes that really great is people don't have to call multiple phone numbers if they're trying to get information. They can call our department, get the information that they need, and we can also start the requests for programs. So the Aging and Disability Resource Connection is actually a statewide service, and it is housed in different organizations based upon that organization's need. Many of them are within Oregon Department of Human Services, like Aging and Disability and Veteran Service offices. Some are within community action agencies. Some are within their Council of Governments. So it depends on the area structure, but for us, it's under Northwest. We have currently 6 staff who answer the phones. So we work like a small call center, and our job is to answer the telephone regardless of what's happening. And so we are answering calls for folks who might need to apply for Medicaid or are newly enrolled to Medicare and need some help navigating through that. We might answer the phone for someone who is a child of an aging parent and something terrible has happened. Maybe they ended up in the hospital, or they have fallen, or they've had the conversation that they can no longer live independently at home, and now they need help. They don't know where to go. They don't know what's available to them. And so our job as resource specialists is to help folks understand what programs and services are available to them. And so our trained staff are available to talk to them not only about programs Northwest Senior and Disability Services does, we can also talk to them about private pay information. So maybe they're looking at wanting to downsize the home and move into an independent living community that maybe has kind of other options like assisted living down the road or nursing facility down the road. We can talk to them about what's available in the area, how they go about paying for that, questions to ask when they go look at that facility. We also, for example, with the fires, our staff was on site at the fairgrounds to do some outreach to help people who were displaced apply for state programs and also help connect them to resources. And so we operate very similar to the service called 211, which is an information and referral service offered through the United Way. 211, though, is designed to serve the whole lifespan. So they often serve folks who are younger or single individuals, individuals without disabilities, whereas our area is more focal and specialized in serving seniors and people with physical disabilities, mental health disabilities, and developmental disabilities. So we have resources for that whole spectrum. And we can often spend a little bit more time on the phone with folks or help get them connected to maybe our options counseling program or another resource that can spend a little more time with them and help them get connected to those resources. What is really cool about our service is not only are we available for folks by phone, folks can still walk in. Our office is still open, although we're trying not to see too many people face to face right now. But without COVID, people can walk in and talk to us and get resources. And the state has developed a really great online service or online database where folks can learn about information pertaining to aging and disability needs, as well as search for their own resources. So for folks who maybe are a little shy about wanting to share what's going on or are maybe not forthcoming, or if we have individuals who their children or other family members who participate in their planning are not local to them and they're trying to find out what's available in their area or even in our state, they can go online to the website and poke around a little bit, get some information, and be able to share that with their family member during some of those more difficult conversations. So I'm going to share with you guys that website and some of the navigation tools available under that website. So I'm going to go ahead and share my screen. So this is the Aging and Disability Resource Connection of Oregon webpage. This is statewide, and this is accessible to anyone who has computer access. So it doesn't matter if you were at the public library, if you're at home, you can even actually get that on your mobile phone and take a look at the resources. It is not yet a mobile based, so you will have to slide around if you're on a cell phone or a tablet, but it is still accessible for folks who might use their cell phones for that. The landing page is really straightforward. You can explore information, you can search for resources, you can also connect with your local ADRC, and then there's some planning tools, so I'll go over a little bit of that as well. One of the things I wanted to point out right off the bat is the planning toolkit. This is a downloadable booklet that helps folks with their planning for their future, i.e. long-term care supports and services. So this is a really great booklet to help people start to kind of think about the things that are important to them as they are looking at long-term planning, staying in home, moving out of the home, what kinds of services are available, etc. And this is available in multiple languages for folks if they do need it translated. It is about 56 pages, so it is something that if you wanted to download it and save it and share it with folks, you're welcome to do so, or you can send folks here to kind of get a digital copy if you don't want to print that out. Back on the page, this page is written in very, very plain language. We tried to make it as easy for folks to understand regardless of their skill levels and what it is that they were looking for. So this is the telephone number for the statewide service. We have a local phone number that I'll make sure everyone has before we're done. But the way this telephone number works is folks dial it, they can enter their zip code, and they will get connected to an aging and disability resource connection specialist in their specific area. If one is not available, then they will get connected to a resource specialist somewhere else within the state who can still provide them that service. This explore your options, give folks some different topics to kind of take a look at. So long-term services. This helps to explain what activities of daily living are, what types of different licensed care facilities. So often we still talk to folks, and when we talk to them about living outside of the home, the first thing that comes to mind is a nursing facility, and we want to make sure people know that that is not their only option. And so there's some really great information here. There is also information about those different licensed facilities, so if people want to take a look at that. More information pops up under each category. So if somebody is trying to compare some costs, these are some older numbers, but these are some of the average costs of long-term care services throughout Oregon from a 2015 survey that was done. There are some really nice worksheets over here that are downloadable. So as folks are planning, if they have resources and are trying to figure out how long those resources might last them, they can use these sheets and plug in their personal information, such as bank balances, costs of their current care setting, those sorts of things. Within the community, here are some more drop downs. adult day services, so this would be respite information, meal programs, senior centers. It is always curious to me that when I talk to folks and ask them if they've been to their local senior center, they always associate that with, no, I'm not there yet, or, oh, I didn't know they offered that. And so we spend a lot of time as a resource connection helping to get people connected to their local supports, including our local senior centers. It doesn't even dawn on them that that might be offered at their senior center, and that they do not have to be 80 to go to their senior center. Chronic disease management. So this would talk about chronic diseases and self-management programs. These are some of the programs that we offer as well. So that information is available. Information about transportation. Some areas have really great transportation options and other areas don't. Some folks need very specific transportation services, and this is a great way for them to find out whether or not those things are available and get connected right away to services. They can search right here for transportation providers in their area. So if somebody is poking around here and are well, I want to know if I have that available, there are links on each of these pages to go right to the resource search. So this just keeps going. There's lots and lots of information here for folks to take a peek at, read up on, get more information, especially if they would like to educate themselves before calling our office. And under the more options here, we have caregiver support information, legal assistance, elder abuse prevention, and assistive technologies. So this would be like durable medical supplies and such. Sometimes assistive technology is not what the doctor's office might call it because it might include other things that are not medically related. For example, gardening, automotive work, traveling, those kinds of things. Assistive technologies in different areas of life. And so there's some really great information here, as well as some connecting right to device loan programs and marketplaces to get those resources. The search feature has been recently updated as of this month. It's now a pictorial search option rather than just the drop down. Folks can still search by a keyword. So if they were looking for meals, for example, we could do 97381 for the area, and we could do meals, and some options kind of start to pop up for us. And if we were looking for home delivered in that area, we will get some of the senior centers, Meals on Wheels through the Marion Polk Food Share, meals through our agency, which would include the Silverton Senior Center, and other resources that are available. So that's available this way. The search is really kind of nice because someone may come here and say, you know what, I'm looking for in-home care. And then are they looking for family caregivers, or are they looking for in-home care services? They'll put in their zip code, and they will be directed to a list of resources right here. And then they can filter. So if they were looking for a service that offered both personal care and, for example, a personal alarm system, they could filter that down and only get those resources. To get more information about a particular service, these are clickable. And so you can go in and learn more information about that specific service. What exactly do they do? Which population do they serve? Is there a cost for that service, and when is it available? These can also be printed out. So if somebody is a social worker who's going to watch this later, or we have folks who help out other members of the community, and you wanted to be able to give them a little bit more information, you could print this out and mail it to them, or print it out and have it there at the center for someone to pick up. So really nice option there. The Connect allows folks to connect with this resource all over the state. And if they don't live in Oregon, they can connect with an ADRC in another state. Aging and disability resource connections are a concept that was brought forward by the Administration for Community Living and the National Council on Aging. They made a recommendation that states really should offer some sort of center, or in our case, we call it a connection, to help folks who are looking for resources get connected to those without having to just be handed a resource list.
Right.
All too often, we see folks who end up with just this big, long resource list, and they're in dire need of a resource, and really what they needed was resource number 9, but they called resources 1 through 5 and got told no, so they gave up and they never made it to resource number 9. And so that's why having trained information and referral specialists like ourselves and like those at 211, we can really have a conversation with a person, find out what their most immediate needs are, and then we're trained to not overwhelm them with resources. So if someone just moved to the area and said, you know, I just moved here from California, I need to get connected to housing and food benefits and medical benefits, and then I also need to get utility help, and I need to set up home delivered meals, and I need to do all of these things. What we would do is we would help them figure out what is the highest priority needs, and we would get them connected to the resources for that first. So if the first thing that they needed to do was find some housing, or they had a voucher that they needed to, you know, move up here, we would get them connected to the housing authority. If they were looking to move into a specific care level setting, such as assisted living, we would help get them those resources. And so we want to encourage them to give us a call back as they meet those needs, rather than give them 20 resources and they have to try to remember what those resources are each for. And so that's part of our trained information referral specialists job. I'm going to go ahead and stop sharing here. Did want to share just a few statistics about the Aging and Disability Resource Connection as a whole here in Oregon. We do a survey on a regular basis. It's every couple of years, but some of our reported outcomes would that be that 93% of folks would recommend using the ADRC to a friend or family member. And so we get referrals not just from our consumers or their family members, but we receive them from the local senior centers, and we receive them from our community partners, such as home health or the hospitals, nursing facilities. We receive referrals from all over. And so it's really great that after we have made a connection with a person, that they would recommend the resource connection to others. A couple of other statistics. For the program year 2017 to 2018, the Aging and Disability Resource Connection had a total of 65,990 information referral contacts. Almost 12,000 of those were done through our toll-free telephone number statewide. And out of those, 99,322 referrals were needed for long-term services and supports. So almost 100,000 resources given in a one-year period. So I wanted to open it up. If there is anything that I didn't touch on, Dodie, that you would like me to talk about, or if anyone has questions.
You know, I do have a question. I think I had mentioned earlier, I do get resource questions from all ages, adults. And, you know, we work with seniors, but recently a good friend, he is needing some assistance. And so even though he's under 30, I could still recommend him to your services?
Yeah, so we still take calls from even folks who aren't aged or disabled. We may not be able to provide all of the resources that they might need, or we may end up providing them with resources to maybe it's connecting them to the housing authority or explaining the differences in low income or public housing versus long-term care placement. So we may end up having more of an educational call to help them know who does what in our area than actually maybe screening them for a Northwest program, but absolutely anyone can call us.
Well, and I had actually given him your booklet, and then I had made some copies of some other resources. And you're right, giving people a resource packet, you know, can be overwhelming. I try to simplify it so they only have a few places really to call, you know, and I think he qualified for services. I just wasn't totally sure which way to direct him. I thought of DHS, but I also thought of ADRC. And so now I will get back to him and tell him to definitely just go with ADRC and see, you know, make that first contact. And you guys will be able to tell him whether he would be okay for this service or not, or to give him the correct information.
Absolutely.
Yeah, good, awesome. Thank you.
You're welcome.
That clears up a lot for me. So we do get a lot of resource and referrals. My biggest one, and now I know also with displaced workers, I've had kind of an increase with displaced caregivers. Usually they're ladies who have been living in homes, taking care of the person. and that person either ages out or passes away, and then
Right.
all of a sudden they have no home, no income, and nowhere to go. And that's particularly challenging for me because, you know, we have a lot of programs and services out there for domestic violence and that sort of displaced person. I don't see a lot for displaced caregivers, but I think that I can direct them to you also, maybe, for some.
Yeah, so some of that there are some things that we just don't do. For example, we don't have a list of contractors. So for folks who are needing to do accessibility building or remodeling, we would refer them to the contractors board. So there are some very specific things that we can refer to and can't refer to. Grocery delivery service, for example, we can't recommend one store over another, but we can explain to folks what grocery delivery looks like, how to go about doing it.
Right.
Um, with caregivers, we can help them to know how to get back on the home care worker registry. We may also recommend that they, post an ad within that the Home Care Commission's directory. We may also recommend them to post a ad on the bulletin board at the senior center, that
Right.
they have
Oh, yeah.
caregiver experience.
Yeah.
So sometimes there just isn't a resource specific for what a person needs, but we can help them to think outside the box.
Right, because a lot of times if someone needs a caregiver, they're going to need a driver also, or, you know, I mean,
Mhm.
full housekeeping.
Housing is one of those. There's just everyone needs housing, and there's no special way to help seniors or folks with disabilities get it any faster than anyone else. We have a housing crisis, which I think all of our social workers are aware of. It's just really hard for our consumers, especially those who are facing homelessness, to know that a waiting list is closed or that they've been on a waiting list for 2 or 3 years. And
Right.
sometimes all we can offer them is reassurance that they're doing the right thing that way.
Mhm.
Because there's not a lot of rental assistance. But if we had someone who's at risk of losing their housing because they're behind on a rent payment or they're behind on a utility payment, we can help connect them to our partners like Salvation Army and St.
Right.
Vincent de Paul to find out about getting SACA, getting those rent assistances. So those are the other types of community resources that we are connecting folks to.
I was going to ask Cassandra, do you still have a connection to OTAG exercise?
So Otago is still a program that we administer. All of our health and wellness stuff got put on hold for COVID, but they are starting that back up. And what they are doing are the personal trainers are still going out to do initial home visits with all of the social distancing protocols and personal protection gear in place. We're also still doing a lot of our like living well classes have been moved to a Zoom platform. Our family caregiver support groups have been moved to a Zoom platform. The majority of our staff are actually working from home, so our case managers are not currently doing assessments in person, but they are doing them over the phone. And so our agency has really adapted to COVID and still being able to provide services at the same level we were before. We still have to jump through a lot of rules, being connected to Department of Human Services. Rules were changing probably weekly in the very
Easily.
beginning. But yes, so still doing Otago, still doing diabetes prevention, still doing living well with chronic conditions, still offering family caregiver support program. Oregon Project Independence is still on a waiting list for our 60 and older, but our under 60 population, that program is open for them. It's a different pool of funds that we have. Medicaid, long-term care, food stamps, or supplemental nutrition. Right now, we're really trying to help those affected by fire get their replacement stuff. That deadline got a little extended. So if you have anybody who comes in who was from the outlying area, maybe didn't have power, and so they lost some of their food items, even though they didn't lose their home, they can do an affidavit to their worker and make sure that they get replacement dollars to replace those food items.
One of the things I found out kind of interesting is the day, it was a Tuesday when they started to evacuate and make everybody leave Silverton or get ready to go. I did come up to the senior center and our wonderful police department called me and said, we knew you'd be there, Dodie. So we'd like you to put out a email blast, you know, to folks telling them what's going on and what to do and what contacts information. And so I went ahead, we have an email list of about 916. And so I emailed folks, blasted them, and kind of funny, the next day or later that day, 5 different members out of that group emailed me back and said, hey, we had no idea about the fires. Our power had gone out. So we hadn't heard the radio or the TV. We didn't even know it was that close. Thank you. And it just occurred to me that, wow, I'm glad. I might have put an email blast out anyway if the police department hadn't asked me, but not necessarily. But it just goes to show you that even though we connect with people and we think everybody has all the information, there's still some folks out there that fall through those cracks. But it felt good that I was able to help people,
Yeah,
aware.
that's what we're hearing as well. So similar here at our office, Tuesday morning, staff came in to direction from the state. So when we have a person who is on long-term care, so they have in-home caregiving or they are in a care facility, we do some planning with them in the event of an emergency. And so we have some emergency contact folks. We also know folks who have limited mobility probably aren't going to be able to evacuate very quickly, or those who don't have a lot of contact. So we actually have a way to pull reports of those in certain areas who have complex needs that need to be checked up on. And so Tuesday morning, after the fire started, our case managers were on the phone trying to make contact with as many folks as they could to make sure they had evacuated. And if they had evacuated, did they get the things that they needed? Or did they evacuate with literally what they had on? And so then making provisions for the state was doing some reimbursement for durable medical equipment. So if people left without their walkers or wheelchairs, to get those replacements, doing some emergency prescription refills for folks who might have left without their prescriptions, making sure that those who lost their homes had some place to go or alternative housing, making sure that their home care worker knew how to find them. So we were doing all of that week as well. And we made contact with every last person in the canyon that is on our caseload.
That's amazing. How many people is that?
I don't know how many total that is, but I know the first couple of days we were still missing a couple folks, but we were able to make contact with them once we were able to get connected to the sheriff's office as well.
And you said you grew up in Mill City.
I did. I graduated from high school in Mill City, and my parents still live in Gates, and my in-laws, because my husband and I graduated in the same class, my husband's parents also still live in Gates. They unfortunately lost their home, but my parents is still standing.
That's what I was going to ask. I'm very sorry for your loss.
Thank you.
And I'm sure it's difficult putting the pieces back together. So
it was really hard to be sifting through ashes looking for my mother-in-law's wedding ring.
Oh, you're gonna make me cry.
I know.
Oh, well,
yeah.
Here we've had all this crazy stuff going on. Who would have thought we'd have a fire?
Right.
Yeah. I mean,
yeah.
I've lived here all my life, It's just, you never know what's going to happen. We're in some interesting times.
Absolutely. And while our agency isn't designed for crisis response, we do try our best to support that. Another example, when Salem had its water crisis a couple years ago,
right.
Same kind. The most vulnerable populations were our clients, and so as an agency, we were making contact with those we knew had specific health conditions based on their planning, connecting with emergency management. And so when folks would call and say, "I don't have water, I can't get out, I can't pack a case of water." Or a jug to the distribution sites. We worked out a plan to get emergency management to, we would email them a list nightly of all the folks who were low on water or needed water, and they would take and go do those deliveries. Or in a few cases, we were able to purchase some water in bulk supply and deliver that. So we do try, even though the majority of our programs are really not crisis related, we do try to make sure that we can connect with our consumers and get them the resources that they need given whatever the circumstances.
Cassandra, I have a question for you.
Sure.
Since I work with Willamette Valley Hospice and Palliative Care, we're coming up into Thanksgiving and Christmas, which traditionally is always a big time for us because typically people
come home and
see
see
mom
their
and
payment.
dad,
Yep.
and they go, oh, we've got an issue. So do you have more people that come on during the holidays, or do you extend your hours, or how does that work exactly?
No, so we don't extend hours and we don't hire any more staff. It's just we do see an increase in call volume during those times of the year. So, and we've, for whatever reason, this last couple of weeks, we have seen a significant increase in our call volume. We receive on average probably about 50 to 60 calls a day. We're seeing significantly more than that. And so to only have 6 staff on hand to answer those calls, we try to answer them within 24 hours, but we are about a day behind right now. And so what we try to do is connect with folks as soon as they're calling. We try not to have it go to voicemail so that we can get those questions answered. But no other staff, because our funding comes directly from Oregon Department of Human Services. We're only allocated so many dollars to do the work that we do. And so, but yes, we experience the same thing you guys do, as do probably most health professionals. Just seeing a lot more referrals, a lot more need, a lot less planning has happened, and everyone wants to try to get that done during the holidays.
I was going to ask another question. I've been working a little bit with United Way
Mhm.
and Nikki Marazani with the Villages program.
Yes, I
And,
know Nikki.
yeah. So how does that work with your folks too? Is that like a resource that you share? Say, tell people that that's. I'm trying to use her in the best way because she has access to resources that might be a little more guaranteed than a volunteer sometimes could be.
Right. So I met with Nikki late last year to talk about, because they had launched their Salem area, and then I knew she was trying to launch out into other areas, and so we do have a resource listing in our database for the Villages program. And so what is great about that is Nikki's program through the Villages fills in a gap area that we can't serve. So we're limited at Northwest to folks being Medicaid eligible or Oregon Project Independence eligible to receive financial assistance to help pay for caregiving services, whether that's in the home or placement. We don't have a list of volunteers that we can readily access that would be willing to do, a quick grocery store run or a quick pharmacy run, something like that. And so we are limited to referring to the Silverton trolley or the Woodburn transportation or chariots, those normal resources. And so for Nikki's program, for those who have some financial resources and don't need a lot of help and can pay the membership fee, people really appreciate it. So we refer to that and help people to know that it's available in their area, since it is not widely out in the whole county yet. So yes.
Great. That's nice to know. You touched a little bit on Oregon Project Independence.
Mm-hmm. Yeah, so Oregon Project Independence is funded through Older American Act dollars. So it is a separate program from Medicaid. It does not have the same financial criteria as Medicaid. So Medicaid requires that you only have a certain amount in monthly income and a certain limit on your resources. Oregon Project Independence is a program that helps to kind of cost share the cost of in-home care. And so that program does still require a service needs assessment. So we do still need to assess their overall hands-on care, and they still have to be within limits set by the state. But what happens is, rather than them paying, say, for example, the going rate of $18 an hour for a home care worker, depending on what their net income is, they may only pay $2 or $3 an hour or less for that home care worker.
Okay.
And that program can help with up to 18 hours a month, depending on their assessment needs.
They're the folks I kind of want to reach out to. We've been talking a lot about, communication and connecting and reconnecting, but it made me think of folks at home again who don't have that accessibility, and primarily your Oregon Project Independence folks, because you're working with them to keep as independent as possible at home. And I'm curious to, and maybe want to talk to you more about maybe as a trial providing a couple of laptops or tablets, I believe, much what the school system's doing. That's very basic, very similar, with just very few apps on it, but just so they are able to have that extra outreach, that extra communication tool that they're missing right now by being home independent. Go ahead.
There are some programs that actually help with that. So the Public Utilities Commission for folks who have a disability can actually get like an iPad through their program. And I know, I think it's Consumer Cellular is doing something similar where it's a iPad with limited apps on it. So there are some of those. Oregon Project Independence, though, is an in-home care. So it's helping with a caregiver coming in to provide them hands-on care assistance.
Right.
So those are folks who probably do have cell phones or technology devices because their care needs are actually probably less than folks who are on Medicaid long-term care.
Right.
It's just a program to help them with the cost sharing.
So that has to be the targeted audience I'm looking for necessarily. They probably already have some type of technology already in place.
Right. So one of the areas that we try to do, so we try to do radio outreach. So I actually just got finished September. I did 6 radio interviews with KBZY here in Salem to talk about the agency programs. We also do John Hughes with Comfort Care. We have a few of those being scheduled. We also have a Facebook page where we're posting information for the agency. And so what we find is those who are just absolutely resistant to the technology are the ones who are probably missing out on some information. And so that's why we also do some campaigns through home delivered meals where we mail, like we stick brochures with their meals.
Yeah. I use that system a lot.
Yes.
Yeah, we deliver anywhere from 40 to 75 meals, you know, because we back up Mount Angel also
Yep.
a couple days a week.
Cassandra, could you distinguish between the Project Independence and the Gatekeeper program, or are they synonyms? Or
No, so Gatekeeper is a program that helps to train members in the community, like meter readers or grocery store clerks or transportation providers, to be on the lookout for folks who might be vulnerable. So for example, we have trained with PG&E. And so when they go out and read the meters for utility bills, if they go to the same house every month, and for 6 months, that house has been perfectly manicured, the newspaper's picked up every day, and all of a sudden for the last couple of months, the yard hasn't been mowed, the newspaper hasn't been picked up, things just seem off, that they would question that, like what has changed, and they would report to us.
But they don't go read the meters anymore, and people don't get newspapers anymore.
But so same thing, Meals on Wheels drivers are trained as gatekeepers. We've trained all of the Chariot's transportation providers. So anybody who drives the bus, they're looking for signs. And actually the utility companies still actually report to us more than you would probably imagine because they get the calls from folks who are struggling to pay their bills and have never had a problem before. So trying to figure out what has changed. Usually it's a cognitive thing. So Gatekeeper is all about training people to be on the lookout for vulnerable populations. And in order to do a Gatekeeper report, they actually need to be a trained gatekeeper. That's how we classify that. Oregon Project Independence is a state and federal funded program that helps people with the cost of hiring a home care worker.
So it's more of a financial piece versus
an actual service, right? So for example, somebody who's eligible for Oregon Project Independence and they make, say, $1,500 a month, they're going to receive a bill from us for services at a reduced cost rather than paying the agency directly.
Right.
And so we're going to pick up part of that cost.
So basically a gatekeeper is just an extension of maybe a mandatory reporter.
Yes. Yeah, somebody who has contact with vulnerable populations or potentially could have contact with vulnerable populations, training them to identify when something doesn't seem quite right. And then they make a referral to our Aging and Disability Resource Connection of the ADRC, and we then reach out to that consumer to try to provide them resource information and see how we can help them.
Cassandra, do you want to share some of your contact information? I think I had somebody just, hold up your business card or.
All right, so let's see here.
Yeah.
The information and assistance. So we have an email address, which would be information.nwsds@nwsds.org. Locally, our telephone number is 503-304-3420, or toll free is 1-866-206-4799. And what's nice about that is it gets people right to our unit. They don't have to go through the front desk, or they don't have to go through the state's enter your zip code, those kinds of things. They come right to us, and then they would get into our phone tree and be able to, if we're not available, we'll ask them to leave a message. Like I said, we do try to return that call within 24 hours, but sometimes given circumstances, we might be a little bit behind on that, but we will return their call.
This has been really, really great. Thank you so much, Cassandra.